Our next presenter is Lauren Lemieux. She is with Strategic Healthcare Initiatives Department at the American College of Obstetricians and Gynecologists. She's been with the college and has served as a member of the QRPH Committee since 2012. Lauren, the floor is yours.
So before I get started, I think it's pertinent to thank Laura Bright and Gila Pike, who are the lead authors on this profile I'm kind of just filling in today. So I wanted to make sure that I thank them before I get started. But moving on, we know that family planning and access to reproductive health services are of interest globally. The statistics that are shown here help to demonstrate the broad commitment of nations around the world, most recently as part of the Sustainable Development Goals to achieve health equity and eradicate poverty, which were adopted by world leaders during the 2015 United Nations World Summit. But the particular use case we're going to discuss today is that of work that is led by the United States Department of Health and Human Services out of the Office of Population Affairs, which administers the Title X Family Planning Program. And this slide just has some background on that program. Authorized in 1970, the U.S. Family Planning Program does provide grants to approximately 90 agencies that support the delivery of family planning and preventative health services in roughly 4,000 clinical service sites to over 4 million people each year. And OPA collects data from all of the 90 grantees through a report called the Family Planning Annual Report, or FPAR. And FPAR is the only source of annual uniform reporting on Title X family planning services grantees in the United States. It really provides consistent data on the U.S. Title X family planning program and that of its users, and it is used for monitoring and reporting. And an annual summary is released every year entitled the Title X Family Planning Annual Report, which I've shown here. So the current submission process for the Family Planning Annual Report data is through an electronic web-based data system, which is extremely burdensome in that it requires dual data entry from the sites. They have the data potentially in their EHR and then have to re-enter it into this portal. So the purpose of this IHE profiling is really to standardize the data that's submitted by OPA, but also to alleviate the reporting burden for the grantees through pre-population of data from the EHR in every possible place that's able to be done. So I did want to mention here, you might be familiar with some of the work that OPA has done previously with IHE. There was work that was done and a supplement for trial implementation was released in September 2014. I just wanted to make note here that this profile is not a revision 2.0 of that 2014 work. It's an entirely new technical framework supplement, so the 2014 release will be deprecated. So what's new in Family Planning V2? It incorporates feedback that was received from participants during the 2015 North American Connect-a-thon, which that previous profile was taken to, and the 2016 Privacy and Security Public Comment. It also incorporates additional data elements that are really help to facilitate and enrich the amount of data that OPA receives to better understand the family planning and preventative health issues in the United States. So to facilitate those new data elements being collected, this project did add new link and SNOMED codes to really help facilitate the electronic exchange of family planning data. So this is just a summary. This is not all of the new data elements, but really it's just a listing of some of the new data elements that are contained within the Family Planning V2, really just helping get a little bit more granular view of some of the data that OPA is looking at. So for example, on sexual activity, kind of narrowing it down into ever, last 3 months, last 12 months, just to help paint a better picture and get a better understanding of what it looks like in the United States. So this is just a basic process flow of the Family Planning V2 profile, which defines 2 ways to exchange the data required for the Family Planning Encounter Report. First, creation of the Family Planning V2 CDA document is supported either directly from a content creator or through transformation of forms data into a CDA format. The other method is through the forms-based collection of data supported through the RFD transactions and pre-population mechanisms to supplement the human data entry that might be required. And then using, of course, the family planning document for pre-population maximizes the number of data elements that can be pre-populated. Ideally, that would be all the data elements, but we recognize that that's not always possible. But by having that pre-population, we can minimize the amount of human data entry that's required. So kind of just ending here, tying back, of course, we know that family planning is of interest around the world and is really broadly applicable to all professionals delivering family planning and related preventative health services. It applies to many different settings, health departments, clinics, and health centers. And then hopefully the addition of Lemieux, SNOMED, and LOINC codes could be utilized broadly to support other projects that are interested in collecting family planning data or exchanging family planning data. And with that, I guess I'll turn it back over to Derek.
Lauren, thank you very much. That was an excellent presentation. Can we open the floor? Are there questions for Lauren and for regarding the family planning V2 profile? Lauren, I know that this is something that updates previous work. Can you tell me quickly how many people were participating in the previous testing of this profile? It was, I remember being one of the most active profiles that we had on the go in course at the time.
Yeah, I don't know actually from that first Connect-a-thon how many tested, unfortunately.
I noticed that you didn't shill quite as hard as James and John did for people to come to Connect-a-thon. So on your behalf, I will suggest to folks on the line that family planning is something that is very much an active and well-funded public health initiative in the U.S. And is tied to some of the encouragements regarding digital health adoption in the country. So for those of you on the call who are in a position to be advocating for this, please consider testing family planning at the upcoming U.S. Connect-a-thon in Cleveland, beautiful Cleveland, in February. Or is it late January? Sorry, I don't have the dates right. Nicole, when are our dates for upcoming Connect-a-thon?
Yes, it is January 15th through the 19th, and like you said, in Cleveland, Ohio. 15th
through the 19th. Well, it won't have got cold yet by then.
Just a little bit.
Lauren, thank you so very much. What an excellent presentation.